Today I'm doing my topic presentation on dentistry. A dentist is a oral health professional that does a variety of treatments and procedures to try and keep their patients' teeth and gums healthy. A normal day for a dentist will include them doing oral examinations. That's your normal checkups. They will do fillings, root canals. They'll look over patient records. They will look with patients and get a dental plan, which is where somebody goes in to the seat to have work done, and let's say they need both sides done, then they just come up with a plan for when the patient's available to come back to do the other side. They'll teach patients about oral hygiene if they need to, if they see that the patient really isn't taking care of their teeth at all. And dentists matter because it is a preventative care service that they offer, and that can be tooth decay and gum related issues, but it can also be very preventative screening for oral cancer or hypertension. As far as the requirements to get into dental school, it isn't necessarily the easiest thing. As I'm looking at the requirements myself, the hardest part is actually getting accepted into a dental school because of the different steps you have to take through their interview process. But as far as the requirements go, you have to have 90 semester credit hours at the time of your application. You must have 6 hours of English courses, 8 hours of either biology or zoology with a lab. You have to have 8 hours of general or inorganic chemistry. You have to have 8 hours of organic chemistry. You must have 8 hours of physics, 3 hours of anatomy, and 3 hours of biochemistry. Although those are the required courses, they also recommend that you would take cellular and molecular biology, physiology, psychology, genetics, microbiology, and developmental biology. And then you have to take the DAT, the Dental Admissions Test, and submit your scores by the November 1st due date. That is the hard due date every year for dental schools that are receiving applications from people. And the DAT, normally you want to shoot for around a 20 as the baseline score, and just think of it as like an SAT type of test. And then once you have all of your classes and that test taken, you will need a couple letters of recommendation. 2 of them need to be from people within your science classes, so biologies or chemistries. And then you will need 2 more letters of recommendation that are going to be from people that aren't from your science-related courses. This could be advisors, people you've shadowed. This could be other professors from other classes that you really like their class, or they had you for several classes. And shadowing hours are not necessarily a requirement for all dental schools, but it is highly recommended that you do have at least 100 hours of watching somebody perform dental procedures. This comes straight from WVU. They said that their successful candidates generally had around 100 hours, and everything else that I've seen just backs that up, that 100 hours seems to be the recommended amount that you have. Dental school is really expensive. It can range anywhere from $120,000 to $424,000, and that is a very big price range, and it depends on whether you stayed in state or went out of state, or what your specialization is within dentistry. So the $120,000 would probably be your general dentist. They go to school for 4 years, and that's just their base cost. That's in state. And if you go to specialize, it is more the more years you add on. And it's just some of those specializations, just to name a couple. Pediatric dentistry, which is general dentistry, but it's really focused on the oral health care of children. Orthodontics, it's the cosmetic side, but it is also making sure that the misaligned teeth are aligned. That way you have a better chance of keeping your teeth healthy. And when teeth grow in bad. I mean, that's the only way to describe it. It is also important that they bring them the teeth that aren't in your normal bite path. They bring them back. Oral surgery is a surgical specialty that focuses on the reconstruction of the jaw, mouth, head, neck, face. They do the surgeries for children born with cleft lips. They are also the ones that will pull wisdom teeth, and I think that is the majority of what they actually do is pull wisdom teeth. Endodontics involves diagnosing and treatment of diseases of the dental pulp. So they are the people that whenever you have a root canal, you may go to, if it was bad enough, to actually make sure that the cap is on correctly. They're the one that actually place the cap on. And then you go to a dentist to make sure everything's okay with your bite and things of that nature. But whenever you have a teeth pulled and you're going to have a fake tooth put in, they're also the person you go to. They will put a screw into your mouth, and then you will go to the dentist after some time to let your mouth really get used to having that hole there. And the dentist will actually place on the tooth given to them by the endodontist. And as far as the impact on exercise science goes, I have about 3 things that I really want to talk about with that. The first is that dentistry does highlight the link between oral health and exercise. There's a lot of people that have bad oral health, and it impacts their ability to do certain things throughout their day. If you're lifting weights, you're not going to be focused on your weight training and could get injured just because you're focused on the pain that you feel, not necessarily the movement that you're doing. Another impact that I have seen is that there's a large shift of people going from biology and chemistry majors to exercise science to get into dental school. One of the people that I shadowed, his son and his son's best friend, both are exercise science majors looking to go into dentistry, and whenever he asked me what my major was and I told him exercise science, he said that that was a good thing. That is, I'm not going to say the easiest path to get in, but it allows you to cover more than a biology or chemistry would as far as your prerequisites go. It's a little bit more lenient with that, and chemistry here didn't allow for me to do any biology at all. That was a big reason that I actually switched majors. And then the last thing I want to talk about, there's no real research behind it. It's something that I noticed as I shadowed throughout the summer, and it came from just general dentistry. That's the thing I really want to do. And as I watched my dentist perform filling on somebody's teeth, they were a larger individual, and I just noticed that he was having a hard time doing certain things with his instruments that I hadn't seen him struggle with. He would have to redo things a couple times and just had a harder time. I asked him about it, if it was because that person had a smaller mouth or anything like that, and he said, no, it's because they're overweight. And then as I watched, more overweight people came in and he had similar issues, and it was generally the back 2 molars, top and bottom on both sides, that they were having problems with and needed fillings, root canals, things of that nature. And it's because the inside of their cheeks are as puffy as the outside. There's no real nice way to talk about it, but as I noticed he was having that issue, he was right. Every time that somebody came in that was overweight, they had similar issues. And it's because they aren't actually able to clean those back molars as well as they could if they were in better health condition. And if he's having a hard time trying to get back there and work on it, and they have all the clamps and things set up for him to get back there and work, what can you do with a toothbrush? So I just think that that's something that if I ever take a research class would be something to be really good to look at, because that might actually help people see, hey, being in better shape will actually help my oral health, because I'll be able to clean my teeth easier, which will help them with costs, lost work production, because now they're not going to the dentist to have a filling done. They're just living their normal lives, and it would be a normal checkup whenever they could. And the job outlook is supposed to, the dentistry profession is supposed to grow 5% from the 10-year stretch of 2023 to 2033, which is about average compared to every job that was on that one website that I looked at. I can actually pull it up and I can tell you the name. It was the U.S. Bureau of Labor Statistics. And the reason I really want to get into dentistry is I've been in West Virginia my whole life. I've lived in southern West Virginia my whole life. I see that people are having to travel an hour one way just to go get their teeth looked at. And if something does go wrong, now they're having to schedule to go be there for however long. They're missing work. They're missing time that they should be doing something else. And there isn't as much of an emphasis on people keeping their teeth. I have a great uncle that when he was 16 years old, he didn't have any of his teeth left. They had all rotted out. And I feel like people need to care more about this stuff, need to see that this is good for you to take care of them. And if they had somebody in their area that would be willing to work with them, it would change the health of people in southern West Virginia. And that is a really important thing to me because, again, that is where I'm from. And I see people just not care. And it hurts because there's something out there that could help them, but nobody wants to go be in southern West Virginia when they can be in a bigger market. And that is a large reason I want to get into this. Money's nice. Money's great. I mean, money doesn't help people in the end. It's your actions that actually go and help them. And by meeting them at their need, because they're not going to travel that hour one way to come see you for 30 minutes, and then they lost 2 hours, 2.5 hours. If you're in their community, they just lost 30 minutes. And I think it'd be a good thing for somebody to actually sit down and look at where they should be to help people the most. That is the whole goal of being in a healthcare profession, is to serve people. And that is why I want to do it. I want to serve people and actually impact their lives for the positive.